Hi everyone, it's Dr. Kit. Wanted to share a case study video spotlights focused on discrimination in health, specifically with poor inequality clinical care and the reality of undiagnosed poor controlled disease. And so that was spoken about within our lecture today with Professor Malia, our lecture this week with Professor Malia. So I used to be a chaplain, a hospital chaplain, and specifically I'm thinking about when I was a chaplain in Hayward, California for a hospital. And so, this could happen anywhere, but I can really, like it was yesterday, really remember a family. This was a Mexican-American family who I think their children were first generation. I think parents were immigrants. And so this family literally came in. The husband, the father of the family, was vomiting blood, and he was literally in his last hours of life. And so, there was this reality, when I spoke with the family as a chaplain, I'm present, listening. They were a Catholic family, but many things came up as it relates to how immigration status and not being legal here in America impacted their reality or their motivation to be able to come to the hospital in fear of being deported. In addition, there was a lack of access to health care. And so because they didn't have health insurance, this patient who was literally suffering with a certain type of cancer literally came to the hospital for treatment in his final hours of life. And so this impacted not only the health of the father of the family. Once he passed away that day, it impacted everything as related to that family livelihood, mind, body, and spirit. So, not just the financial means, the presence of the father and the husband being there, but also, impacted the family in many different ways. Even as it relates to access to resources, because even though that family was here illegally, that father was still continuing to work to provide food for that family. And so all interconnected, these realities, I will never forget that, the image of that family and their suffering during that time because of that lack of access to health care based on their immigrant status, based on lack of access to insurance, and even to this week talking about race and class and even nationality. All of these things are interconnected, and very much so are connected to discrimination in health and inequality. Okay, so this was just a case, an example that I thought about that brought to life even more what we've been learning this week. Okay, talk to you soon.